Hello, everybody. I'll take my mask off. My apologies. Hello, everybody, and welcome to this press briefing on non-communicable diseases and COVID-19. As you may well be aware, that people with underlying illnesses, generally non-communicable diseases, are much more susceptible to the severe form of COVID-19 and death. We have with us several experts, Dr. Bente Mikkelsen, the Director of the Department of Non-Communicable Diseases for WHO, and Dr. Nick Banatwala, who's head of the UN Secretariat for Non-Communicable Diseases. And they will outline not only the problem, but the way forward. Now, this is a hybrid press conference. I'm sure you're all used to it. I'm less used to it. Um, please raise your hands. I can't see any hands raised in the list of participants at the moment, but please raise your hands and I'll take your questions after presentation, first from Dr. Mikkelsen, and then she will hand over to Dr. Banatwala. So Dr. Mikkelsen, you have the floor.
Thank you very much, and good morning, good afternoon, and maybe even good night to some people. We are very happy to be here today to brief you on the current situation on non-communicable diseases, meaning cardiovascular diseases, cancer, diabetes, and respiratory diseases, and with a specific focus on COVID-19. So I am sure that you are all aware that non-communicable diseases currently kill over 40 million people a year worldwide, making up 7 out of 10 deaths globally. 17 million of these deaths are people younger than 70 years of age, and we call them premature deaths, dying too young. And the great majority of these deaths are between 30 and 70 years old, and the majority is in low and lower income countries worldwide. So coming back to the pandemic, to the COVID-19 and the lessons learned and what we have seen. The pandemic has laid bare 4 major diseases the world has basically ignored during the last decade. So cardiovascular diseases, cancer, chronic respiratory diseases, and diabetes. And today our primary task is to defeat COVID-19 pandemic and also to take the learning point and rebuild, recover, and build back to rebuild lives and livelihoods. But we must not simply return to where we were, and I will make some points around this, and so will my colleague Nick Banatwala. So the world is at a critical juncture, as demonstrated by 4 studies which have been published during the last few days. From WHO, the most recent study is a study that showed that there is a disruption in healthcare services, including NCD diagnosis and treatments, in 69% of the cases. So this is really the 4 diseases with the greatest disruption. And cancer diagnosis and treatment is among them the highest number. So 55% of the people living with cancer has had their health services disrupted. So that's why we use very strong words. It's actually a deadly interplay between the big challenge we have already from non-communicable diseases with the situation that has happened now during COVID-19. So there are 2 facts that we have to be aware of, and the moderator has already mentioned. First of all, the people living with NCD is those who are most at risk to become both severely ill, but also to die from COVID-19. And we have several studies showing this at the national level. So for example, in Mexico, among registered death due to COVID-19 cases in the indigenous population, diabetes was the most frequent comorbidity. And in Italy, we saw these people dying from COVID-19 in hospitals. 67% of people living with hypertension and 31% were people living with type 2 diabetes. The second study was a study from Lancet, also coming out this week. And it it shows that the global ambitions to accelerate the progress of universal health coverage and the services linked to this are increasingly unlikely unless concerted action is happening on non-communicable diseases. The third study is the very recent, published yesterday, the WHO Lancet Imperial College and NCD Alliance study called the Countdown 2025, which is actually tracking all the countries to see how the progress is going on. And what we see is that only 17 out of 194 countries are on track to reach the 2030 targets that was agreed by the ministry, the heads of state and governments in New York, reducing the premature mortality, dying before 70 years of age, with 1/3 before 2030. So only 17 out of 109 countries are able to achieve this for women, and only 15 for men. So the good news is that all countries can still meet the 2030 targets. So WHO provide best buys, which is kind of a silver bullet to fix the situation, but the window of opportunity for implementing these policies with the highest return of investment is now, and it's closing fast if we want to reach the 2030 target. The last publication that came out this week is what my colleague Nick Banatwala will focus on, is from the UN Interagency Task Force, WHO and UNDP, under the leadership of WHO, which has agreed on a joined-up response to help countries to include NCD as an integral part of COVID-19 and recovery plans across the UN. So what I would make a sort of underscore at this point is that there is a call to action. And I think that people living with NCD all over the world is waiting for us, for WHO to support countries and for countries to really act on their commitments made through 2011 until today, to work together to build at the future where all people are covered with health services, medicines, vaccines, diagnostic and health technology for both prevention, screening, early diagnosis, and also appropriate services for NCD. So before I leave the floor to my colleague, I would like to say that COVID-19 has been almost like an X-ray. It's revealing fractures in the fragile skeleton of the world we have built in the last 2 decades. It is actually exposing where we have failed, but also where we need to put action in place to really fix the situation for the people living with NCD, but also for all populations to prevent people from getting NCDs. So what we have seen is that in the time range from 2000 to 2012, we had a very rapid improvement. And the reason was very much that we were able to decrease the mortality for cardiovascular and chronic respiratory diseases. Many actions were put in place, and people were protected also by actions on tobacco and all the 4 risk factors, but especially tobacco. Since 2012, this has dwindled, and we even see some very alarming signs, namely that for diabetes, we have even an increase of 5% for premature mortality. So this is actually going in the wrong direction. So over the past 20 years, we have had a result of 200 million premature deaths among women and men. And in the next decade, another 150 million people will die, mostly in developing countries. And you also probably know that the risk of dying is totally unequal. So it's 3 times higher in Fiji, Guyana, and Mongolia than in Japan and Norway. Only 1/3 of the countries can provide drug therapy and counseling services to their populations to prevent heart attacks and strokes. And only half of the countries have guidelines for the prevention, early diagnosis, and treatments of the 4 major diseases. Still, we know what we can do. We know how to facilitate, and I will come back to this also as part of the question and ask session. So I will now leave the floor to Dr. Nick Banatwala, who is the head of the Secretariat of the UN Interagency Task Force for Non-Communicable Diseases. Thank you.
Thank you very much indeed, Bente, and good morning to everyone. It's a pleasure to be with you today and to share this new suite of publications that will be launched shortly by the WHO Director General. These papers are about responding to NCDs during and beyond COVID-19, and they come from the UN-led, the WHO-led UN NCD Task Force on NCDs. They're targeted at governments, policymakers, UN agencies, and development partners, and of course, you in the media as well. The papers are clear. The COVID-19 pandemic, as Bente has illustrated, should remove any and all doubt as to why addressing NCDs is crucial for health and sustainable development. In different contexts worldwide, NCDs and their risk factors are increasing susceptibility to COVID-19 infection and the likelihood of worse outcomes, including in young people. Let me give you some figures to complement those that Bente has provided. They're the results of research from academics across different countries, and they demonstrate the scale of the problem. Obesity increases the risk of becoming severely ill from COVID-19. In a study in France, the odds of developing severe COVID-19 were 7 times higher in patients with obesity. Smokers are 1.5 times more likely to have severe complications from COVID-19 and had higher mortality rates, according to a recent analysis. And the systematic review has shown that people with diabetes are between 2 and 4 times more likely to have severe symptoms or die from COVID-19. And the situation is likely to be even worse for people with uncontrolled diabetes. Here are a few more. People with chronic obstructive pulmonary disease are at increased risk of severe complications or deaths from COVID-19, according to a recent meta-analysis. And a study in China indicated that mortality rate from COVID-19 was significantly increased in patients with cancer and was particularly high amongst those with blood cancers. Overall, almost 1/4 of the global population is estimated to have an underlying condition that increases their vulnerability to COVID-19. And most of these conditions are NCDs. Powerful stuff. So what are the main messages coming out of the papers in addition to the challenges raised by the sorts of statistics that Bente and I have just described? First, for many years, the global community has not given NCDs the attention, investment, and action they require, even though cost-effective solutions for NCDs have long been available, as have reports on the significant return on investment in prevention and control. Let me remind you, 70% of deaths globally are from NCDs. And yet, NCDs receive less than 2% of development assistance for health. Second, COVID-19 is exposing our collective shortcomings in addressing NCDs while exacerbating NCD burdens. For example, the pandemic and measures taken in response, for example, lockdowns, have severely disrupted prevention and treatment services for people living with NCDs. In some cases, these have led to an increase in behavioral risk factors for NCDs, such as physical inactivity, unhealthy diet, and harmful use of alcohol. Third, the papers provide a call to action during the immediate response, the recovery, and building back better in the context of NCDs and COVID-19. The actions reach across all sectors and include actions for heads of state and government and parliamentarians. Many of the most cost-effective, evidence-based and feasible approaches for tackling NCDs, for example, taxing on healthy products and establishing and enforcing marketing and advertising restrictions, require fiscal, regulatory and legislative action across government. Indeed, We argue in the papers that COVID-19 provides an important political window of opportunity to move forward, as a number of countries have done, on population-wide preventive measures to reduce the main NCD risk factors, which Bente described earlier. Finally, these papers highlight how the UN needs to scale up its support to countries. Indeed, one of the papers is devoted entirely to this. The task force was established in 2013 by the UN Secretary General and is under the leadership of WHO. But over 30 of these members have contributed to these papers. And this is no small deal. These papers are a strong call to action, and be clear, the United Nations is united against non-communicable diseases. The task force and its members recognize that they have huge responsibility working through the UN country teams in country to scale up their support to governments in their efforts to ensure that NCDs is an integrated part of the COVID-19 response and recovery. We hope that you will help WHO and UNDP that led the development of these papers in collaboration with others in the task force disseminate these publications, particularly next week during NCD Action Week that starts on Monday. Thank you very much.
Thank you, Dr. Van Waller, and thank you, Dr. Bente. We'll now take questions. I'm not seeing any hands raised. I'm not sure if that's a problem with the system, but we have a question in the room, so we will start with you. Go ahead, Gabriela.
Yes. Oops. Thank you. I'm Gabriela Sotomayor, Mexican journalist for Proceso. My question is, from the beginning of the pandemic, it was known that people with these diseases and disease were at greater risk. So my question is whether governments that knew that their population was more fragile should take another strategy and implement more protection or protective measures to these people who have these comorbidities. So I don't know how to say in English. For example, in the United States and in Mexico, there's, we have those problems. And the people in charge, they knew, because it was before the pandemic it began in China. I mean, they had time. So that is my question. Thanks.
Thank you for that question. And I think it's very important to say that I think all governments have really had to focus on the COVID-19. And we can see that from our disruption survey that as the pandemic developed in countries, they had to sort of increase the shift to COVID-related health services. So, of course, this is very important. But what we saw was that, for example, in the national preparedness and response plans, all the chronic diseases and the non-communicable diseases was in very few cases really reflected. So WHO has worked with the member states now to add guidance both for the preparedness and response plans. But of course, as I think both Nick Banatwala and myself has pointed out, I think this is yet again a very, very, very strong reminder that it's not during the pandemic we can fix this fragility. This has to be the continuous fixation of and mending the system to really respond to NCD. So I think it's very important to see that, countries has been responsible as much as they have been able to do. What we also saw was a very interesting phenomena that most countries actually started very quickly to register comorbidities. So I think as close to 70% of the countries recorded comorbidities. So this is also something that we can learn from. We will be able to look into this and also to support countries to do scenario buildings to be prepared for a next pandemic in combination with acting towards non-communicable diseases. Thank you.
Thank you for that question. I still do not see any hands raised. I'm not sure if there's a problem with the system or if everybody's overwhelmed by the level of information they've just received. But we have one other participant in the room, but not raising a hand. Can anyone indicate in chat if they're trying to raise their hand and they're not getting their question? I see some. Is it Jeremy? Jeremy, are you trying to ask your question? Oh, somebody is coming through. I'm not seeing any further questions. I just want to make sure that.
Margaret?
Yes?
Oui, bonjour
Moussa.
Margaret. Peut-être vous ne voyez pas les noms chez vous parce qu'il y a moi et Jérémy qui ont levé les mains. Alors, je voudrais poser une question concernant les gens qui prennent des médicaments à vie, comme les greffés, donc les greffes de rein ou autres, qui prennent des médicaments, des immunosuppresseurs. Et ces gens-là, comment ils vont faire, par exemple, avec les vaccins? Est-ce qu'il y a aussi quelque chose avec le Covid qui sont plus sensibles que les autres? Et surtout avec les vaccins, est-ce qu'ils pourront prendre ces vaccins ou pas? Merci.
Thank you, Musa. I'll just translate your question for our participants. We don't have an interpreter service with this press conference. So your question was, are there particular medications that should be used for people who've got non-communicable diseases? Are you saying, are there different approaches to treatment that we should be looking at? Was that your... Est-ce que c'est votre question, c'est les médicaments qui sont très importants avec le COVID?
Oui, donc les gens qui prennent des médicaments, par exemple, les gens qui sont greffés, ils prennent des médicaments à vie, des immunosuppresseurs. Et là, donc ces gens-là, comment ils vont faire avec les vaccins? Et aujourd'hui, est-ce qu'ils sont plus sensibles que les autres avec COVID-19?
Ok, oui. Ok, je comprends. So the question is what about the vaccination strategies for people who've got non-communicable diseases, and what about treatments when people have both non-communicable diseases and COVID-19?
So thank you for the question. Sorry, I will have to answer you in English. First of all, of course, healthcare personnel are very well aware of people living with non-communicable diseases. And to my knowledge, they have really done their ever best to continue the care. And it's very interesting to see that when we asked for what kind of mitigation strategies countries applied for the health system disruption, very many countries really spoke about telemedicine and digital solutions, and of course home care, and also task shifting to other people in the community. So we have seen a lot of investment really to try during these extremely challenging situations to take care of the people living with non-communicable diseases. I think that at the sort of the community and the hospital level, there has never been a question. It was recognized very early that people with diabetes, cardiovascular diseases, respiratory diseases, and cancer were at specific risk. And if I understand your question correctly, we expect, of course, that when we eventually get a vaccine, there will be, of course, specific protection for patients at risk when the government are sort of allocating the vaccines. All that said, we also know that this has been a stress test to the whole world's health system, and the test has shown that we have to do much better. So I think there is a lot of learning telemedicine is wanting, task shifting, more use of outpatient clinics, but also new methodology to get coverage of medicines, which was reported as 20% of the disruption, the main disruption factors. Thank you.
Thank you very much, Dr. Mikkelsen. I now have got the system working, and indeed there are questions. The next one goes to Emma Farge from Reuters. Emma, unmute yourself and go ahead.
Good afternoon. A couple of questions for Ms. Mikkelsen, if I'm allowed more than one. So you've obviously touched on this, but I was hoping you could just really spell out to what extent your concerns on progress on NCDs stalling, or in the case of diabetes reversing, is due to COVID-19 disruptions, and to what extent long-term factors. And then I'd like to follow up if possible. Thank you.
Thank you for that question. So the negative development for diabetes is a trend that we saw before COVID. We still don't know the effect of COVID on the total sort of global development for NCD mortality. This is something that WHO and partners are working very hard to estimate. So unfortunately, the many of the figures I referred to in the beginning of the press conference, coming out of the Lancet Imperial College NCD Alliance WHO publication, is trends that we see already. So we see inequity, we see differences between gender, we see very huge differences between low and high income countries, and we see, as you mentioned, the very negative development for diabetes. So one could assume that since we have seen and that people living with NCD are the one especially being severely ill and dying during COVID, that it will actually worsen the situation, but we don't have global figures on this yet. Thank you.
Thank you very much. And Emma, we do have the luxury of giving you a second question. We're not as mean as we are in the afternoon. So do ask your second question.
I was curious about mortality, but I take your point that it's too early. I was curious about disruptions to NCD care in the Americas, because that obviously wasn't a region that was part of the survey that you released a few days ago. So to what extent do you have concerns about disruptions in that region because of the pandemic and more broadly?
So the weaker the health system, of course, the more at risk the population with chronic diseases and especially non-communicable diseases. This is something we saw from the first survey, and this is something I'm sure we will see again. And as I mentioned, it has been a pan-programmatic disruption survey that came out this Monday, and it sort of again underscored the rate of disruption for non-communicable diseases. So I think the trend is clear. Also, the trend sort of during the peak, during the development of the pandemic.
Thank you very much. And Dr. Banadwala, if you want to jump in, just let us know. Otherwise, next I will go to Lisa Schlein, who's been waiting patiently. Go ahead, Lisa.
Am I unmuted? I'm not sure.
You are. We can hear you loud and clear.
Okay, and I'm very impatient, Margaret. Sorry to disabuse you. First, just a quick question. Will you be sending us a press release? I hope so, because that would help with the numbers that you have been talking. It's a little difficult to follow up on that. Okay,
of course.
All right. Thank you. And then for my question now, from your information, the preventive actions that need to be taken, the screening, diagnosis, and so forth of NCDs, that fell down in 2012, well before the COVID-19 pandemic appeared on the scene. what are the reasons for that? And I assume that the situation is much worse now because people just, because of lockdowns and so forth. But since it's well known that people with NCDs, with pre-existing conditions, are more susceptible to severe infections, do you have recommendations for the healthcare workers who who can see that somebody coming in with the infection also suffers from diabetes or cancer or what have you, for them to take particular measures with them immediately instead of kind of musing on what should be done? And then secondly, you mentioned cases in studies in Italy and Mexico on the impact of NCDs on COVID-19. Do you have similar studies in developing countries? I'm assuming that the situation may be worse there, but maybe you don't have the proper information, and if particular care, particular measures need to be taken in countries in Africa, for instance. Sorry, that's pretty long-winded. I hope you got it. Thank you.
So I'll try to answer your question. So maybe I will start with the last one. So we see that at the national level, we have more and more publications speaking to the first phenomena, let's call it that. So the first phenomena is the increased risk for severe illness and death during COVID for the people living with NCD that has COVID. So we have many publications coming out, and we have from India, we have from South Africa, and so on. So these are national studies, and of course, one of our role as WHO is really to support the countries in to get these published. And as I said, a good piece of news, which we discovered through the survey, is that most countries started immediately to also record, the comorbidities for the people coming in with COVID. And we are also now working with the member states also to look at not only the situation during COVID, but also the rehabilitation after COVID. So that's sort of the one thing. And of course, what we want to see is also the global numbers of the comorbidities. So this is something that is underway in WHO. The other phenomena is the disruption. And you were asking for guidance. So of course, guidance is on very many different levels. So one level is on the healthcare worker side, and I think there is no doubt that they knew what to do. The problem, and actually it was the healthcare workers and the people living with NCD themselves that really alerted both us and their governments that the disruption was happening, is that, of course, during a very serious pandemic like this, you had a shift to COVID, so it was lack of capacity. That is what disruption means. So the second level of guidance was something that we, as WHO, developed very early on and was developed more in detail, which we call operational guidance for healthcare services. And this was a very important guidance to policymakers at all levels to know what is the first thing to stop when we need the capacity for COVID. So this kind of guidance is there. I think maybe this is what you asked, I hope at least. And I wanted to add one thing that I didn't mention because it was a question about medicines, which is of course part of the health system services. And what we see is that many of the new ways of maintaining medication for chronic patients is real innovations. So that's also something we will really systematically go through and try to utilize for the Building Back Better perspective. If Nick wants to add to this, maybe.
Yeah, I'll just take an opportunity just to reflect on a few of the questions. And we've said, of course, absolutely, COVID-19 has had a huge impact. on non-communicable disease, and we'll only see it being played out in later years when we know quite what the long-term effects are. But we know again that, in Italy, over 2/3, 68% of people who died from COVID-19 in hospitals had hypertension, and 31 had type 2 diabetes. And in Spain, 43% of patients with severe COVID disease had cardiovascular disease. So it's a big issue. But I want to come back to the first question, which was around, do we need a different approach? And what are the lessons learned? Well, in the papers that we set out, we do look back, but really to look forward. And I think one thing is clear is that we do have these so-called cost-effective interventions that are widely available, these so-called best buys. And a lot of them, when it comes to prevention, and Bent has spoken a lot about the treatment, but when it comes to the prevention in terms of population-based measures around tobacco and alcohol, unhealthy diet, physical inactivity, these are policies which governments can take forward if they have the political will to do them. And we have seen during COVID-19 a number of countries that have used COVID-19 as a window of opportunity to try and tackle tobacco use or harmful use of alcohol. And what we would encourage is, rather than reducing this as things get better in those particular countries, that they use this as an opportunity to actually step up on these evidence-based actions, whether it's around taxation that I mentioned earlier, whether it's around marketing. And I think that going forward, it's about taking these well-established policy measures that everybody knows has worked. It's been shown time and time again that they are cost-effective, what the return on investments are, and making them work. If we go back to a publication that was produced by WHO back in 2018 called Saving Lives, Spending Less, and I would really encourage everyone to look at that. It highlighted that for every dollar invested in these evidence-based interventions, these preventive measures, these best buys, the return on investment is $7 by 2030. So that's quite an important statistic. And it also goes on to say that between now and 2030, we could save 8.2 million lives using these initiatives. So I think that some countries are already starting to think about this seriously now, because they have seen what the impact of NCDs and COVID has been together. We've got this, if you like, as some people have described, a perfect storm coming together with inequalities. And I think now is the time to be looking forward to and starting to implement some of these very effective interventions. Thanks.
Thank you, Dr. Banatvala and Dr. Mikkelsen. It looks like there are no more. Another question in the room. Peter Kenny, go ahead.
Yeah. You mentioned the fact that in some countries have used the COVID-19 lockdown to counter alcohol use and tobacco. And I know that in particular in South Africa, there was a total ban on the sale and any commercial activity involving tobacco and alcohol for a considerable part since the beginning of the lockdown. Do you have any data to show that that had any good effect or any effect? Thank you.
So I cannot tell you if these experiences has been published, but we know from before, because this is our best buys. So we know at large that this will really be the way to avoid non-communicable diseases or reduce the risk. So, but of course, I think as you remind, the world, I would say, it's extremely important that we document the effects both on the short-term interventions, on the positive, the innovations, but also on the disruptions, as we have discussed. So this has been things that we have been very, very happy about. Unfortunately, we have also seen the opposite, that we have had a negative influence during COVID, and we have been less able to protect communities and governments for undue influence from also, unhealthy food, tobacco and alcohol. So I think many countries has alerted us and really made a case that we have to strengthen again the focus on prevention, and to strengthen the focus on prevention is the real way to avoid the situation and the very heavy burden, of course, on the healthcare system in the first place.
Thank you very much, Dr. Mikkelsen. I cannot see any more questions online. I know that there are a very large number of you online. It's a very well attended press. It's a very well attended press conference. So I think our speakers have provided you with such rich information. They've answered most of your questions. So I'm just going to hand back to Dr. Mikkelsen for final words.
Thank you very much, and I'm extremely happy that the journalists are interested, because honestly, we really need to build back better, and we need strong voices from everywhere to support this. This has been a very, very, I would say, serious reminder of work that has been lagging behind. So, of course, the response to the pandemic must be based on the agreement that addresses precisely the failures that has been exposed and also exploited by the pandemic. And today, NCD remains the largest, most underfunded public health issue. And I think that was the one I forgot. I was asked, why didn't it happen before? And of course, we have to realize that the funding has not been what is needed, neither to prevent or to handle NCD. And also my colleague Nick talked about investment cases. That has been one of the ways we have tried to support countries in really understanding the way that they can have return of investment. I think what we are asking for is immediate collective action, and we have tried to summarize these in some bullet points, and I would like to just end at least my intervention with this. I think one of the learning points is that we have to learn more from the HIV/AIDS situation, which is actually very similar to what we see in the area of non-communicable diseases. So we need to secure seats for people living with NCD at the decision table. And that is actually what has partly been happening during the COVID as well. It's their voices, they're also their suggestions, solutions, and so on. Then there is a need to make the case even more clear. So we need to set global targets for the main diseases like hypertension and diabetes to be able to track if we are actually progressing. So we can celebrate when we progress, and we can address how to mitigate if we don't. Then, of course, and I think we all agree that what is needed, and this is about the health system, is to strengthen primary health care, to include the essential services for NCD into the UHC, as the Lancet publication reminded us on this week. We need to have benefit packages for NCD like we have for other diseases. Otherwise, we cannot protect people against these diseases and also give them the equity for treatment. Then, of course, there is a need to develop new approaches and to close the humanitarian, the gap between the humanitarian, the development, the NCD during normal times and the pandemic is also something that has to be part of the building back better. The fiscal measures, which is part of also the best buys, need to be focused. There is a need for international and domestic funding to be able to close the gap. And then, of course, there is a need for partnership, and I think the COVID-19 and the mitigation strategies has shown us that digital health and digital solutions co-created with those actually both living with and also the healthcare workers is part of the solution. So thank you very much from my end, and I guess Nick has some concluding remarks as well. Thank you.
Thank you very much. I would only just say one thing that I haven't mentioned so far, but the paper does highlight the important role of civil society in holding governments, the UN system, development partners to account. And of course, when we think of the civil society, media is critical in that. And so I would really encourage you and your colleagues, not only just to kind of report on one particular event in one time, to be following things through, to be investigating how the tobacco industry is permanently undermining public health. What is the alcohol industry doing in terms of harming health and making efforts to make sure that public health is secured? What about food and beverages? Where are good examples where things are happening well? Where are the bad examples? Where are there conflicts of interest? And I think investigative journalism is really very powerful. And so what I hope that today might encourage, as well as disseminating some of this information, is an appetite for ever greater investigation in terms of what's going on amongst our populations and communities to ensure that public health is, as we've seen during COVID-19, held as a priority as we build back better. Thanks very much.
Thank you, Dr. Bennett-Weiler and Dr. Mikkelsen. And on that strong call for action, I'll also let you know, for more information, you can contact us through media inquiries. My colleague, Jamie Guerra, who's here in the room, is fantastic, and she will provide all kinds of information. And there are some documents that should have been sent to you already electronically. We'll be sending out. Okay, so we will be sending more documents related to all the things that have been discussed today. And do come back to us with all your queries. Thank you very much for attending.